we were to describe ourselves, we have a pretty good sense of who we are. Sometimes an easy way to think of it is imagining how you might describe a brother or sister or a child if you have children. Their personalities are pretty clear to you. A personality disorder is some sort of dysfunction in those enduring traits. So as opposed to other types of mental illness, when you think about something like depression, that's episodic. It comes and it goes, and when it's treated with medication, it can pretty much be completely mitigated or minimized in a person's life, and their personality is still there, separate from the depression. When we have a personality disorder, there are going to be disturbances in several different areas that are visible in almost all different facets of their life.
How did you conclude that Ms. Heard suffers from the personality disorders that you identified?
So there was information that supported it from multiple sources. I conducted testing, including one of the main tests that I used. She obtained scores that were consistent with those diagnoses, and then I also, there was evidence of those diagnoses in her records and in her self-report.
Factors that you considered in determining that Ms. Heard suffers from personality disorders, and one of them, I think the last one you said before you left, was self-report. What do you mean by that?
So the self-report would be things that Ms. Heard indicated to me specifically. So there were a couple of characteristics that she noted in her self-report that were consistent with these personality disorders. The first was actually my own behavioral observations of her based on her self-report. So one of the hallmark characteristics of histrionic personality disorder is sort of a overly dramatic presentation. We call this impressionistic speech. So it tends to be very flowery. It uses a lot of descriptive words like magical, wonderful, and it can go on for quite some time, and yet it really lacks any substance. So at the end, you're left wondering what was just said or what the answer is to the actual question. So that occurred a number of times. And it also represented the quick shifts you'll see between emotions. So she would suddenly be one way, and then she would become very animated or very sad. And when people are displaying these emotions with this personality disorder, there's a sense of shallowness to it. People who are observing them will feel like it's almost play acting, and they might not be able to put their finger on it, but part of it is because of the rapidness with which the person can switch emotions, and also the lack of substance. They don't really refer to, I feel this way. They might describe emotions, they might describe events, but very rarely, and Ms. Heard did not say, I feel vulnerable. She never really indicated a vulnerable feeling of her own. Then the substance of her self-report. So when I was asking her information about her history, so there were a couple of characteristics that she noted in her self-report that were consistent with these personality disorders. The first was actually my own behavioral observations of her based on her self-report. So one of the hallmark characteristics of histrionic personality disorder is sort of a overly dramatic presentation. We call this impressionistic speech. So it tends to be very flowery. It uses a lot of descriptive words like magical, wonderful, and it can go on for quite some time, and yet it really lacks any substance. So at the end, you're left wondering what was just said or what the answer is to the actual question. So that occurred a number of times. And it also represented the quick shifts you'll see between emotions. So she would suddenly be one way, and then she would become very animated or very sad. And when people are displaying these emotions with this personality disorder, there's a sense of shallowness to it. People who are observing them will feel like it's almost play acting, and they might not be able to put their finger on it, but part of it is because of the rapidness with which the person can switch emotions, and also the lack of substance. They don't really refer to, I feel this way. They might describe emotions, they might describe events, but very rarely, and Ms. Heard did not say, I feel vulnerable. She never really indicated a vulnerable feeling of her own. Then the substance of her self-report. One of the reasons was to assess whether Ms. Heard has post-traumatic stress disorder, which I told you about earlier, as a result of the incidents that she's alleged occurred by Mr. Depp. And that's a really tough disorder to find out if somebody's faking it or not. It's one of the most easily faked disorders. Most of us know what it feels like to feel anxious. And a lot of people have seen war movies and movies that depict somebody having PTSD. And in fact, some research has shown that if you give someone a diagnostic checklist and said, show that you have PTSD, they can do it 96% of the time, just someone on the street. So you really need a test that's very sensitive to that. And the MMPI-2 has been shown in multiple studies to be excellent at detecting those attempts.
Okay, you keep using MMPI-2. That's the abbreviation that you folks use for?
I'm sorry if I hadn't said that. That's the Minnesota Multiphasic Personality Inventory.
Okay. What other psychological testing did you perform?
So I also performed the clinician-administered PTSD scale, -5, and that -5 links it to the diagnosis for PTSD in our current diagnostic manual, the 5th version. To do that test, you first administer something called the Life Events Checklist. And the Life Events Checklist, both of these tests, by the way, were developed by the National Center for PTSD with the Department of Veterans Affairs. But the Life Events Checklist lists 16 different very stressful life events that people can go through that are often can be associated with developing PTSD. And then it also has a 17th item that you can fill in if you feel like you've been through something really difficult that wasn't included. Now, I like to also add something called the Life Events Checklist 5 interview, which digs a little bit deeper into the person's childhood as well to find out if there's so many different things that can be difficult growing up. And also, it's very important that you have the person determine which of the events they've listed, let's say they have a number of different types of traumas, which one do they feel like was the most traumatic for them? Which one still causes them to feel distressed when they talk about it? And sometimes they can't just identify one. And then that leads to your next decision. So if they have multiple different similar types of events, like seeing combat, then you might use that as the worst one, the multiple similar. So that looks like you describe an anchor, we call it, to do the testing, and we would maybe describe the anchor as the worst of my combat experience, okay? Now, if somebody had multiple different traumas from different times in their life, like childhood abuse, and then went to combat and had some horrible things happen there, you would do the clinician-administered PTSD scale test, the one that comes after. You do one for the childhood event and a separate one for the adulthood event. Ms. Heard had the clearest code type was 3-6, but then she also had some other code types that were less significant.
What characteristics are associated with a 3-6 code type?
So a 3-6 code type, a lot of that anger is expressed in this code type. There can be actually a lot of cruelty, usually with people who are less powerful. Actually, when you see this code type, you want to, if you can, to follow up with subordinates, co-workers, people who may have observed their behavior more closely. The 3-6 code type is very concerned with their image, very attention-seeking, very prone to externalizing blame to a point where it's unclear whether they can even admit to themselves that they do have responsibility in certain areas. A lot of suppressed and denied anger, but the anger is very present, will explode out, and a lot of issues in their close relationships. Is a disorder of stability. It's instability, and it's instability in personal relationships, it's instability in their emotions, it's instability in their behavior, and it's instability in their sense of self and their identity. And that instability is really driven by this underlying terror of abandonment. So one of the key features also of this disorder, and all of it is like pistons of an engine kind of firing off and igniting one another. But when somebody is afraid of being abandoned by their partner or by anybody else in their environment and they have this disorder, they'll make desperate attempts to prevent that from happening. And those desperate attempts could be physical aggression, it could be threatening, it could be harming themselves. But these are behaviors that are usually very extreme and very concerning to the people around them. The anger is typically what, sadly, it's counteractive, right? So the thing these people fear most is being abandoned, but over time, the anger, the explosive anger that they show when somebody is needing space, or when somebody's really not doing anything wrong, because a lot of times they read into things that they perceive as being a slight to them or being somebody intending to harm them that actually isn't happening. They'll exaggerate it, and they'll explode. They'll react in this heightened manner that is just exhausting for their partners. Oftentimes their partners will try to make them happy at first and really allow themselves to be a punching bag, thinking that they can somehow solve this problem, that somehow they can make this better. And eventually it just overwhelms them.